So, some more elbow? By the end of this quick little podcast, you should be able to describe how distal biceps tendon ruptures occur and be able to list some classic features of a distal biceps rupture. So it's moving day, and Mark here is a 45-year-old guy who is being helpful. Unfortunately, the other guys lose their grip on the situation, leaving Mark suddenly holding the whole piano. There's a pop, and the piano goes down. He has pain in the front of his elbow, but the elbow does move. So what are our diagnostic options? Around the elbow, there are 4 muscle groups. We have flexors and extensors of the elbow, and then the common flexor and common extensors of the wrist and hand. This is unlikely to represent a fracture or dislocation scenario, as the movement of the joint is conserved and the mechanism is less likely. On balance, Mark decides he should go see a doctor, so he pops over to his urgent care center next. The duty physician notes that he's got pain over the antecubital fossa. He's weak in supination particularly, but a little bit in flexion, and he's not tender around his epicondyles. His x-rays are normal. Of these menu items, the only muscle that does both supination and flexion is good old biceps brachii. Skipping to the end, this is a distal biceps problem. This photograph is a classic picture of what that can look like clinically. The other 2 flexor muscles just don't have a structure or natural history that typically gets into this sort of trouble. Distal biceps ruptures are almost exclusively seen in males, typically in middle age. The biceps is firing hard when the mechanical load overwhelms it and it's forced to lengthen while it's still contracting, and we call this an eccentric load. Recognizing this injury right away allows for rapid surgical repair and recovery of almost all the supination strength. Delayed diagnosis can complicate the options. So, to review, we've taken a quick look at how distal biceps tendons can rupture and how to recognize them.